EVOLVE-MS-1 was a clinical trial looking at patients on diroximel fumarate, so primarily looking at safety issues with diroximel fumarate, but we also were able to look at efficacy. So patients, it was a 96-week trial, and so 1,057 patients were randomized, or not randomized, we were just continued in on diroximel fumarate for 96 weeks. What we were able to see is if you look at baseline relapses before people entered annualized relapse rate, and then you looked on drug, the reduction in annualized relapse rate was 82% in the overall cohort. We did look at the group of patients that switched from S1Ps. So there was 33 patients and they were all on fingolimod. And then we also looked at 32 patients that were on high efficacy treatment with monoclonal antibody. And they were all primarily on natalizumab except for 2 were on ocrelizumab. And so we looked at those switches. And so the patients that switched from S1P had an 87% reduction in relapses, annualized relapse rate. And then the high efficacy monoclonal antibody patients had a 70% drop in annualized relapse rate. If you looked at contrast enhancing lesions, overall it was about 73% in the overall cohort, the 1,057 patients. The ones that switched from an S1P medication had a 73% reduction in enhancing lesions and 100% reduction in enhancing lesions in the high efficacy treatment. Now, you might say those are really surprising results. The one important thing to keep in mind, though, is there was a delay for some of these patients in switching. So some patients switched with a brief washout period per protocol, but some patients were, like years later, they switched. So the median time in the S1P group was 462 days, and the median time to switch was 723 days on the high efficacy. So some of these patients were coming into the diroximel fumarate after taking hiatus, although it kind of suggests that these people did have required high efficacy treatment, at least at some point during their course. So I think what it means is that there are some patients that, that could be candidates for fumarate after using an S1P medication or high efficacy treatment. Obviously, you have to kind of think about, that switch. So if someone's highly active, we don't have huge data sets, looking at like a direct switch from someone straight off of natalizumab over to diroximel fumarate, but it's a consideration. And particularly those patients that seem, it could be an option for some patients.